Hi, this is Dr. Carlin Alt, and I'm going to give you a drawing of the extrinsic finger flexors and extensors and the intrinsic finger muscles and how they connect. We will start with the palmar side up, and I will first draw in flexor digitorum superficialis. Remember, it comes through the carpal tunnel, and it will come up at the PIP joint. It's going to split to attach at the base of the middle phalanx. There will be 4 tendons that all show that same shape. All 4 tendons are coming through the carpal tunnel. Attaching to the base of the middle phalanx. Next, we will draw in flexor digitorum profundus, also coming through the carpal tunnel. This is a green marker. The profundus travels along with superficialis, except it will come all the way out to attach at the base of the DIP joint. Therefore, it will be a flexor to all the IP joints, as well as an accessory at the wrist. We now have 8 finger flexor tendons passing through. So profundus will flex at the DIP, PIP, MCP, and accessory at the wrist. Superficialis, PIP, MCP, accessory at the wrist. We'll now turn the hand over and we'll draw in extensor digitorum communis, the common wrist extensor. It comes up at the level of the MCP. It's going to fan out, and it will continue on from the MCP joint as a central tendon to the proximal phalanx, attaching base of the middle phalanx. Also at the MCPs, we will have 2 lateral bands that are going to swoop around like a bypass to that middle joint, and they will make their attachment. They'll come back together to attach at the DIP joint. So the extensor digitorum continues to the PIP and DIP joint as 3 separate structures. 2 lateral bands to the DIP, 1 central tendon to the PIP. Now, at the MCP joint, this will fan out and it will make 2 types of bands. One band is called sagittal because it's running transverse or perpendicular to this extensor tendon. It's going to come around and actually attach onto the volar plate on the flexor side of the MCP joint. There are also oblique fibers that insert into the lateral bands. Any structure that's inserting into the lateral bands or the oblique fibers will be able to perform extension at the PIP and DIP joint because they will sit dorsal to the axis and can function as extensors at the PIP and DIP joints. Now we'll turn the hand back over. The first intrinsic muscle that I will draw in will be the lumbricals. The lumbricals always run on the radial side of the digits. So the thumb is on the radial side. They will originate off of the profundus tendon and they will insert. So they're going to start on the profundus tendon and they are going to come and insert into these oblique fibers of the extensor mechanism. They start on a mobile flexible tendon and they insert on an extensor mechanism that also is mobile. All of the lumbricals will attach on the radial side of the respective finger. So that means that the first and second lumbrical will be abductors and abductors to the second and third finger, whereas the third and fourth lumbrical will do adduction to the ring finger and adduction to the pinky. Again, they are MCP flexors, IP extensors. The next muscle, intrinsic muscle I'll draw in will be the dorsal interossei. They are bipinnate muscles. They come off of the metacarpal and they insert into the extensor mechanism and the base of the proximal phalanx. So the first dorsal interossei is bipinnate, coming off of the first and second metacarpal. Those fibers will come together and make an attachment to the base of the proximal phalanx as well as into the extensor mechanism. Into the extensor mechanism allows them to act as IP extensors, and they will pass volar at the MCP joint and will be MCP joint flexors. Because they are attaching to the base, the proximal phalanx, they can either do AB or adduction. The dorsal interossei will always be positioned that they can do abduction. The second dorsal interossei comes off of the shaft of the second metacarpal and the shaft of the third metacarpal and will come up and attach to the radial side of the middle finger, which is our reference segment. MCP flexor, IP extensor, and it will abduct the middle finger radially. The next dorsal interossei will come off of the third metacarpal and the fourth metacarpal and will attach on the ulnar side of the middle finger. MCP flexor, IP extensor, and will abduct in an ulnar direction. The fourth dorsal interossei will come off of the shaft of the fourth and the shaft of the fifth metacarpal, and it will attach on the side of the ring finger on the ulnar side and will act as an abductor. Same as the others, MCP flexor, IP extensor. The pinky has its own intrinsic muscles to do abduction, so we don't need a dorsal interossei there. The last intrinsic muscle are the palmar interossei. We will talk about 3 interossei. They are all unipinnate. There will not be a palmar interossei related to the middle finger because it's our reference segment. But I need one that will allow the index finger to move towards the middle finger, the ring finger to move towards the middle finger, and the pinky to move towards. So that means that muscle is going to have to come off of the metacarpal and attach on the side of the base of the phalanx such that it can contract and perform adduction. For the ring finger, the unipinnate palmar interossei will come off of the metacarpal and will attach at the base of the proximal phalanx and will perform adduction. And the third palmar interossei will come off of the shaft of the fifth metacarpal, attach to the base, and will perform adduction. And the palmar interossei, just like the dorsal, will have an attachment to the base of the proximal phalanx and into the extensor mechanism through the oblique fibers into the lateral bands. So all 3 palmar interossei will perform adduction at their respective joints, as well as accessories they will be primary MCP flexors and can extend at the PIP and DIP joints. Additionally, you should think about 3 intrinsic thumb muscles and 3 intrinsic hypothenar muscles, innervated by the median nerve, abductor pollicis, abductor pollicis brevis, flexor pollicis brevis, and opponens pollicis. And on the pinky side, we will have abductor digiti minimi, flexor digiti minimi, and opponens digiti minimi. Ulnar nerve innervation, median innervation. Thank you.
And one last point, the lumbricals are oftentimes referred to the 2 most ulnar lumbricals as being bipinnate. I drew them as unipinnate. Some books will list all 4 lumbricals unipinnate. Others will have the 2 medially located, ulnarly located lumbricals as bipinnate. Just heads up. Thank you. Bye.